Okay, everyone, this is part 2 of week 4 that I wanted to record to you, which we're going to talk about evidence-informed practice in school social work, navigating practices for student success. So we're going to go ahead and get started on this one now. So basically for our introduction, our objective today is that we're going to define evidence-informed practice and the importance of evidence-informed practice in school social work. So in chapter 3 of our book, the author defines evidence-informed practices as a process of transparent, culturally sensitive, and pragmatic practice choices with a client that draws on the best available empirical evidence to help clients solve their problems. So EIP is explained as collaboration between the school social worker and the client to find interventions that work with the client's preferences, and keep those preferences in mind, that also have empirical evidence that support that their use will help to improve the issues for that client, and the problems that that client is experiencing. It is not based on the so-called expert status of the practitioner. So the practitioner-client relationship is what makes the evidence-informed practice work, right? So when you have evidence-informed practice, what we're actually kind of looking at are predominantly these things. So we're looking at an evidence source, so the evidence-based practice versus evidence-informed practice. So in evidence-based practice, it's really something that they use more in like hospital settings or in settings where things can really be clinically held, controlled. In a school setting, it's pretty chaotic, and so that doesn't happen. And so evidence-based practices is predominantly through quantitative research. It's usually based on the best available research, is how you make a decision on it. The role of the social worker is the implementer of the proven intervention. So the intervention has been proven a lot of times. These are kind of your, you go out and you get trainings and they tell you, okay, here's the course that you're going to be doing, and you have to read it verbatim out of the book, how they've read it, and kind of run the groups or the individual, whatever it is, exactly as they've run it. It's much more structured and less adaptable, and it has standardized interventions, right, as its focus. So like I said, it has like, you have to do this at group 1 and do this and say this and that type of stuff. Whereas evidence-informed practices is a little bit broader. It includes qualitative research as well as quantitative and other forms of evidence. So anecdotal evidence based on your clinical judgment and the research that you've done, evidence, that type of thing. The decision-making is to consider research within the context of the individual student needs. So each student is different. The schools are very different. The kiddo that you have today is not going to be the same one that you have next year at the same time. So the evidence-informed practice that worked for them the previous year may not work for that student. So you have to adjust it. Role of the social worker, it's much more flexible, integrating evidence with professional judgment. So this is where I talk about flexibility with fidelity, right? Fidelity with flexibility is really the key to what social workers need versus those canned, must say type things. It's highly adaptable to the individual and to their contextual differences, and it's more holistic. So you're really looking and considering the whole child in their environment, and not just the standardized interventions of what's happening. So that's kind of the difference between evidence-based practice and evidence-informed practice. And what we're looking at is evidence-informed practice, EIP. So in evidence-informed practice, the goal is to improve student outcomes. So EIP helps school social workers to identify and implement interventions that have been shown to be effective in improving student outcomes, such as their academic achievement per se. Mostly as social workers, we're working at behavior and social-emotional well-being. It enhances your professional credibility because by using EIP, school social workers can demonstrate that their practice is based on sound research, which enhances their credibility with colleagues, administrator, parents, students. You don't just look like, a guru pulling things out of your hat. And then it does help to increase your efficiency and your effectiveness, which in the school social work is so important because you've got kids coming in constantly. So EIP can help the school social worker to be more, like I said, efficient and effective in their work by providing them with the evidence-based strategies that are more likely to be successful. And so this can help to free up time for the school social worker to focus on other important tasks at the school, such as like building relationships with students and with families and home visits and resource allocation and all of that. Some of the challenges, though, to the EIP is there's really a lack of time and resources. So school social workers often have very limited time and resources, which can make it difficult to find, review, and implement research evidence in their practice. I'll be quite honest, most of the research I do is done on my time, nights and weekends, after school, before school, that kind of thing, because there's just no time during the school day, although I try to make time, or during my lunch. Resistance to change is another one. Some school social workers, when you're inside the school, you may get this resistance to change. Then it can be difficult for you to adopt new practices, even if they're supported by research. If the staff isn't buying in on it, or the principal doesn't believe in what it is that you're doing, you can kind of hit that problem as to what's going on. Or if you haven't convinced the parents or the kiddo that what we're doing can actually help them, you can get that resistance to change. It's a normal part of social work. Resistance to change, it's everywhere. And then difficulty accessing and interpreting research. This is probably the hardest part for the majority of school social workers, because once you graduate from UNLV, you no longer have access to the library. So you kind of have difficulty assessing and interpreting the research, especially if you don't have a strong background in research methods. It's hard to find articles that are not protected against a paywall. So you got to look for open resource articles, that type of thing. So it makes it a little bit harder. It can also be difficult because a lot of times companies have done this research and they're charging for it, right? Rightfully so. They've done all the research. They have this amazing evidence-based practice that they want to do. And they want to charge you for the training or for that type of stuff. And so you're trying to interpret what they're doing into your informed practice without having to pay all that money, because schools don't have money. So the way we kind of overcome those challenges is we want to make sure that we're collaborating with our colleagues and with the administrators. So as the social worker in the school, you can really kind of work with them, share the resources, share your ideas, get their support ahead of time. Kind of, I've been doing some research and it's kind of showing that XYZ might work. What do you think? And, kind of get their buy-in and feedback as to where things are going. You can seek the professional development opportunities. So you can try to find opportunities to learn more about EIP and how to implement them inside of your practice. Sometimes you can find lots of times actually, you can find free webinars and different things that are kind of going on out there. I don't know if I have it in here or not, or I just thought about it. I need to put it in so that you guys have access to it. It's the, oh my gosh, my brain is fried right now. I can't remember what the heck it's called, but it's basically they supply free webinars all the time that you can go. The problem is they supply them during the school day and you're busy during the school day. So. And then utilize technology and online resources. So there are a number of technology and online resources that are available to help you to access and to interpret research, such as databases, search engines, online courses, that kind of stuff that's all free. So in the EIP process, we have these kind of 5 steps that we're doing, and this is coming from Kelly inside of the book, Evidence Informed Practices, out of chapter 3. So step 1 is we want to make sure that we are identifying the clients, right? The problem or the need, and clearly define the problem. See an answerable question is created. So you can do this through various methods, such as interviewing the client, observing the client's behavior or the student's behavior, reviewing their records. It's important to clearly define the problem so that you can develop this answerable EIP question. So identifying the problem and then developing your question is the next step. So once you identify it, you create an answerable evidence-informed practice question. So the book recommends that you use the SMART method, which is the specific, measurable, achievable, relevant, and time-bound when you're defining the problem. So you want to work on it that way. So for example, the school social worker could develop an evidence-informed question that says what is the most effective way to improve academic performance of a ninth grade student with ADHD, right? So that might actually be your SMART thing or whatever that you're working with. So it's, you know, again, specific, measurable, achievable, relevant, and time bound, right? Because we know it's ninth grade. Then you're going to do your research. So you're going to go out there and try to figure out, you know, what's happening, what's going on. So you consult your online databases to find the best evidence for the EIP question. And the next step is to consult those databases. So find the best evidence for the EIP. There are a number of different databases that are available. Dr. Kelly recommends, you know, PubMed, ERIC, PsycInfo. But social workers can also join things like the School Social Work Association of America, and they have all kinds of like articles and things like there as well. And then I believe in the, either have it in the resources or it's in this actual module where it has other sites and so forth that you can go to that share different things, listening to podcasts, listening to different, you know, things like that, that can also help you to kind of connect and figure out what to do. Ask other social workers, what are they doing? And then we have share the evidence. So you want to share the evidence with your clients. You want to use accessible language and, you know, explain to them what the interventions are based on the evidence. So basically, once you've done all of this, you want to make sure that you're involving everybody and that they're understanding what it is that you're doing. So you can use the evidence to develop and implement interventions that are actually tailored to those client needs. And then lastly, you're going to evaluate it. Like here, you went out and you did all this research and you're trying to figure out, does this work? Does this not work? How could I tweak it maybe for the next kiddo? And so Professor Kelly, I'm sorry, Dr. Kelly, he was my professor. He was at Loyola University, so I just slipped. But he evaluates basically the interventions generated and then repeat the process as needed, right? So you would evaluate it. Does this work? If it doesn't work, then you kind of retweak your problem and kind of go through the steps again. And so you can do this evaluation through various methods. You could track their progress, you could interview them or review their records. And then if the intervention is effective, then the school social worker can repeat that process and can repeat that actual intervention and develop new interventions that are more likely to be successful. So some of the best practices that we have for this is schools always work in teams. So it's important to understand that when you go to work in a school, you are working on a team. You are not a solo act. So in the evidence-informed practice, it's much more effective when it's implemented using this team-based approach. And this allows social workers to pool their knowledge and expertise and learn from others as well. So you don't just want to, you know, go in and say, oh, I found this, really try to get input from the team, the school counselors, the teacher, the kid, the parents, you know, whoever. Involve the stakeholders in the process. So it's important to involve them, the clients, the families, the administrator, and so forth. This helps ensure that the interventions are tailored to their actual needs and supported by the school community. So you don't want to come in, you know, if you're wanting to do, say, mindfulness and you're deciding to do meditation, and instead of doing it like a tier 2 or tier 3 service, you want to do it at tier 1. And your research is showing that, you know, if the whole school does mindfulness for, you know, 2 minutes at the beginning of the school day, that, you know, test scores are better. And so every time that there's a test or something on Fridays that the school is doing, then that day, you know, they're going to go ahead and do this mindfulness piece, or maybe they're going to do it at each class as each class begins, and you want to ensure it happens. And so you've decided that, you know, the principal is going to be the one to lead this. And after every single class in a middle school, for every single day on Friday, they're going to do this mindfulness thing. Well, it might sound like a really good idea, but the process in that and you volunteering other people may not work out. So you might have to really talk to your stakeholders and see what they're willing to do, which is what makes it the team-based approach. And then consider the context and culture of the school. So it's important to consider that for sure. What's the size of the school? What's the location? What's the demographics? And then, you know, document. And then provide ongoing professional development. Don't be afraid to, you know, put all of this stuff together and present it to the teachers at the school, to the parents at the school, to the principal at the school in a professional development, so that they're understanding what it is that you've done and what you all have come up with. Some of the ethical considerations for EIP is, again, you want to make sure that you're respecting client confidentiality. So you don't share information that, isn't educationally relevant or that you can't share. You want to make sure that you avoid harm. Sometimes some of the interventions that we think we're doing, we think are actually going to be very effective, but in actuality, they have like a negative side effect to them. And it could harm the client more than help them. And so it's important that you kind of think of those things. What is this going to do to the kid? So let's say, for example, you are in an elementary school and your principal does not like you pulling the kids out because they have a firm belief that if the kid is not in the classroom, then the kid is not learning. And so you decide to do your evidence-informed practice, which is a group of 12 kids maybe, or 10 to 12 kids, whatever, at lunchtime. So you're taking the lunchtime away from those kids. So now you have to think, am I causing more harm than not? So I can tell you with my son, when he was in elementary school, if you took away his lunchtime, you were definitely causing more harm, right? He's upset. That's the only reason why he goes to school. He didn't like his classes or, anything else. And there are lots of kids out there that are like that. So you would actually inadvertently be causing negative side effect because they're not getting their recess. And so the group could be seen as punishment instead. And the kids aren't going to want to come. So you want to think about those things. And then make sure that you have the informed consent. So you may have to get conformed consent from the kids that are doing it. So if you want to do it at lunch, that's fine. But then ask the kids, are they okay with you doing it at lunch or not? And if they're not, then, how do you do it differently? Maybe you could do it at lunch and, give them, special pizza, or you bring in, a certain thing or whatever once a week so that they feel like, it's extra special kind of for them. And you make sure that the group isn't just a talk group, but that you're actually, doing games and that kind of stuff. So they don't necessarily feel like they're missing out on recess because you're providing that kind of stuff for them. So you want to make sure that basically that the client is fully informed about what's going to happen, the risks and benefits of it, the intervention that you're going to be doing, and that they're willing to participate in that. So the multi-tiered systems of support, MTSS, and evidence-informed practice, they go hand in hand. So basically, you are going to use the behavioral, social, emotional support. It's going to go for all students. We have the 3 tiers: universal, targeted, and intense. I have the triangle on the next slide, so I'm just kind of going over this quickly. And then evidence-informed practice is obviously used at all 3 tiers, right? Because you want to make sure that Tier 1 has been research-based, Tier 2 is research-based, Tier 3. I was just told that I'm going to be the new chair for Tier 2 interventions at my school. So I'm getting books now and learning about Tier 2 interventions and, how am I going to implement them, what the ideas are, all of that kind of stuff, so that when we get there, we're ready to do those targeted supports for those kids and that the team's on board. So this is our MTSS, and these are kind of some menu of evidence-based supports that you could use with this. So Tier 1 is down here in the green, got 2 universal supports. So some evidence-informed practices that you could use for that would be school-wide PBIS, which is positive behavioral intervention supports, social emotional curriculum, which is the SEL. The good behavior game is one of them. I have that later on in like the evidence-based information. And actually have a really cute video of them playing it. So it's kind of cute. It's in YouTube. There's 17 proactive classroom management, which is another evidence-based support that you can use. Psychology for learning, diet, exercise, sleep, hygiene, stress management. So these might be some evidence-informed practices that maybe you want to put into your Tier 1 supports for the whole school. Then when you get up into Tier 2, these are going to be your selected kiddos that have not responded to these universal treatments. They say it's 10 to 25% of the students, but it's actually higher than that. And then we're working on actually it's smaller than that. But anyway, in this one, you're working on classroom and small group strategies. So for example, some of these might be behavioral contracting, self-monitoring of the student, school-based home notes, a mentor-based program. I don't have check-in, check-out on it, which is kind of interesting because it's probably like the biggest one that we do at Tier 2. Differential reinforcement. So differential reinforcement just means we'll make it individualized for each kid. Targeted peer reporting, and then small group, social emotional learning or social skills. And then some evidence informed practices for tier 3. These are more targeted interventions for your high-risk kiddos. You're going to do like FBA, behavioral intervention plan. When we get into the FBA section, I have some really cool stuff, everything FBA. There's a class that I found that was like open. Hopefully they haven't closed it down, that had everything that you need for it. It was really cool. You might do replacement behavior training, cognitive behavioral counseling therapy, or like family therapy, wraparound services, agencies, and that kind of stuff that you send off to. So these are like some of the ones that are just kind of like standard in your hat to work with, but then, you know, the kids can be a little bit different. So when you work MTSS and EIP together, basically it really kind of helps you to improve, you know, your overall effectiveness of your multi-tiered systems of support, intervention, strategies, all that kind of stuff. And then it really helps to implement it in a systematic and sustainable way. So you would say, in order for them to enter into tier 2, what criteria do they have to have? And how do we make sure that they're there based on our tier 1 intervention? And then, you know, based on that criteria, how do we place them into the different groups? MTSS is very unflexible. So it kind of fits, but doesn't, because the EIP is more flexible. So anyway, I won't get into that. So basically the importance of EIP in school social work is, you know, it helps school social workers to improve student outcome. It enhances their professional credibility. And again, it increases their efficiency and effectiveness. School social workers can overcome challenges of the EIP by making sure that they're using a team-based approach, seek the professional development opportunities, and utilize technology and online resources. And then there are a number of best practices that school social workers can follow to ensure that they're implementing evidence-informed practices in an effective and ethical manner. And MTS and EIP can really be used together to provide that comprehensive system of supports. And then I have some really cool resources in here that you can work with. So this is CASEL, Collaborative in Academic, Social, and Emotional. We've got some great stuff that's going on here. Oh, this is really good. Evidence-based behavioral practices. What Works Clearinghouse is a great one to go in to kind of do some research to see what type of evidence-based practices can you get. So all of these are like really good. And most of what they have in here, the databases themselves are free. You can find evidence practices that are free. Some you may have to purchase. And, you know, then you do your research and you go to the school and you say, hey, can we purchase this? And can I get trained on it? And, you know, hopefully you've done a really good job with that. And they say, yes. And they send you away, or they say no, and you make it up based on evidence. So this is again where the class would take a 10-minute break if we were live, but we were not. So I'm going to continue. But if you feel like taking a 10-minute break, there's a video and comment. So for those of you who didn't pause, we'll continue. For those of you who did pause, we'll come back. I'm going to continue. So next we're going to talk about evidence-informed decision-making and how do we kind of like work on that and understand how that kind of works in school social work. So basically, what is evidence-informed decision-making? So evidence-informed decision-making is a framework that integrates the best available evidence, professional expertise, and client values to make your informed decision. So it's kind of like evidence-informed practice in that way, but it's also a little bit different, and I'll show you as we walk through here. It's crucial in ensuring that decisions are not solely based on intuition or unsystematic observations, but are actually backed by solid evidence and contextual understanding. And that's kind of the thing that we really want to get into home with this, right? Is when you're doing evidence-based practices, evidence-informed practices, how do you make that happen? So the core principles of this one is that we want to make sure that we have an examination. It's based on these multiple factors. We want to include research evidence. We want to ensure like the contents of the case. We want to make sure that workers' biases are taken into accountability. We want child and family values and preferences to ensure comprehensive and effective decision-making. So these are kind of the core principles. So the way that this process works, Dr. Kelly had a 5-step process. This one is kind of a 6-step process. So, but it starts at the beginning again with just identifying the problem. So in EIDM, you're going to involve several key steps to ensure it. So you're going to identify the problem clearly, formulate your question. This doesn't say to make it smart or measurable, just to make sure that you're formulating your question. Then search for that evidence, just like you would start any kind of research what you're doing. Then you want to appraise the evidence. So actually kind of look at it and figure out what works, what doesn't work, throw it out or not. And then you're going to apply it, evaluate your outcomes, and then, identify the problem again. So did we improve? What was going on with it? The kid improved, but we're still having problems, but a little bit different. And then you just, keep going in your circle until the kid is all better. But the structured process makes sure that we have a systematic approach to decision making. So when we identify the problem, it requires a thorough understanding of the issue at hand and gathering the relevant information again. So again, you want to look at multiple sources, such as the different reports, the family members, and different, collateral people and things that are out there, and make sure that you're doing that. So basically, you have to do an assessment. There's a lot of school social workers out there that are so busy and they're like, oh, but the kid comes in and then I just, talk about whatever is in front of them. And then the kid goes out and then the kid comes back the next day and they don't understand why. And part of that is because we didn't really identify the problem, right? We're so busy because you have so many kids that are coming that you're not doing an appropriate assessment. And you have to do an appropriate assessment with the kid and figure out what is the issue, what's kind of going on with that, and how do we get more information to kind of help that kid. So step 4, then you want to formulate a question. So in Dr. Kelly's, he uses the SMART theory in order to do that. In this one, they use what they call PICO. So basically, we're going to create a specific answerable question using PICO. So we're looking at the population, we're looking at the intervention, the comparison, the outcome framework. So I'm going to go over each of these so you get what we're talking about. So when you're doing the patient problem or population, it's a patient problem characteristics, condition, disease, or health issues of interest. A lot of times they use PICO in the health industry. So you might use the condition, disease, or health issue. You would just change that with the behavior issue. You want your intervention or exposure. So what is going to be done? So are you doing community support? Are you doing CICO, which stands for check-in, check-out, small group, classroom support? What is the intervention that you're kind of looking for to help with this kid? Then you want to do a comparison. So what is the alternatives to this intervention? So is there a standard curriculum that you could give? Is there, instead of just small group, can you do social emotional type of stuff? Like what is the comparison that's kind of out there for you? And then you're going to look at the outcomes. So you want to look at their academics, their social emotional learning, their behavioral outcomes. You could look at their health record. Maybe you have a lot of stigmatization and the kid's going to the nurse's office a lot. So you can like work with them that way. So that's kind of using PICO. So let's formulate a question using PICO because we've probably never done this before. So in a middle school students with moderate behavioral issues, that is your P, right? That's the population. Middle school students with moderate behavioral issues. Does a check-in, check-out intervention, right? So that's your intervention, right? Check-in, check-out. Does it reduce office discipline referrals? So that is our outcome, right? That we want to kind of know, right? Reduction of office discipline referrals. So we got the PICO a little bit mixed up. That's my bad. Does it, you want to more effectively than traditional teacher mediation behavioral intervention? So this is your comparison, right? So you're saying, will it reduce the office and referrals more effectively? So basically we're comparing check-in, check-out to traditional teacher mediation behavioral interventions, and which one is actually going to decrease office and discipline referrals, right? So that's your PICO. That would be your question that you would formulate. So basically this one, in the evidence-informed practice, I gave you an example of a tier 2 intervention. Here, I'm giving you an example of a tier 1 intervention. Right? What can the school do to help well, I guess it's still tier 2. Yeah, I take that back. It's still a tier 2 intervention, check in, check out, compared to the teacher mediation. We want to know what's better. So then you're going to search for your evidence. So searching for the evidence involves identifying reliable sources and using, again, reputable databases and academic journals to find the best available evidence relevant to your question. And again, It's going to be difficult once you're out of college because, you know, you don't have access to this, but again, you have all these free things that are paid. And then you want to utilize your online databases, academic journals. In the EIP resource page shown earlier in this slide deck, I have all kinds of resources that you can go to get for the same exact kind of stuff here. So all of it is based on evidence, right? Which is why you have to look for the evidence. So that's why that little annoying thing is still go search for the evidence. Then you want to appraise your evidence. So appraising the evidence involves assessing its quality and its relevance. And this involves looking at, it could involve looking at the methodology that they used in the research and critically analyzing the findings to ensure they're robust and applicable to your context. And then you want to apply the evidence. So when you're applying the evidence, it involves integrating it with your clinical expertise and the values and preferences of the client. So all of this still goes with cooperation with your clients, right? It's not you believe that this is the best thing to do, right? It is what does the client and I believe is the best way to help them with this particular problem. This is the key change between going for a kid going in and seeing a school counselor per se and a school social worker or the dean, right? Because they are the adult and they are the expert and they are going to tell the kid what is best for them to improve their situation. School social workers do this in a collaborative way, and we say, what does the child think is going to be the best way to improve their situation? And then we help them to do that based on what it is that they want done. So it's a different way of thinking, and it's usually why I believe school social work is more successful a lot of the times. We don't have the repeat offenders if we do this appropriately. If we just act like a school counselor or a dean and just run the kids through our office, we're not doing the assessment and the skills that we have, then we're really not doing school social work, right? We're not working with the family and all that kind of stuff, because you're also going to talk to the family. What does the family want to see done? And then you're going to implement those interventions based on the best available evidence. So that's where you're going to use your clinical expertise to say, okay, what's the best available evidence and how do we do this? So then you want to evaluate it. So how do we evaluate these outcomes? So this is the very final step. And evaluating the outcomes includes systematically tracking the effectiveness of the interventions and making adjustments based on the results. This step is crucial to ensure that the chosen intervention is meeting the desired goals, and you can refine the approaches needed. In the PICO question, we had asked in middle school students with moderate behavioral issues, does the check-in, check-out intervention reduce disruptive behaviors more effectively than a traditional teacher-mediated behavioral intervention? So using that example, right, if we went out and we're collecting the information that's out there, we are going to monitor. So let's say we're tracking Alex's behavior daily using a progress note. Reports, we note the number of disruptions and incidents before and after implementing check-in, check-out, right? So first we're going to kind of go in, we have to establish our baseline. So we're going to collect the data on the student's current behavior to establish the baseline, and then we might use behavior tracking sheets, discipline records, teacher reports, behavior attendance grades, right? We bag the student is what we call it. Then you're going to implement it. So you're going to begin the check-in, check-out intervention with the student, ensure consistent implementation according to the plan that you developed, and you're going to use your daily progress reports, your check-in, check-out sheets, right? Those type of things. Then you're going to monitor them. You're going to say, okay, regular monitoring the student's behavior using the same tools used to establish the baseline, and then update your tracking sheets, daily progress reports, and teacher feedback forms, so that way, you know, those are the tools that you're kind of using. Then we want to go to analyzing your data. So you're going to compare the data collection during the intervention with the baseline data, and you want to look for improved trends. So you could put, for example, if you're doing a check-in, check-out, you could just put that into a spreadsheet, however points are running before the intervention and then during the intervention, and then you just, you know, look at, chart it and see, you know, are we getting better or not, and have it put in a trend, a data trend line, right? You can use a data analysis software, behavior graphs, Excel, right? Anything like that that's going to work. I'm going to collect feedback from the teachers, from the parents, from the student, get a qualitative sense of the intervention's impact. So That just means you're going to interview all of them. Do they feel like it's working? Does the kid feel like this is working? Does the teacher actually see that it's working? You could do that through surveys, interviews, feedback forms. Then you're going to make adjustments. So you want to determine if the intervention is effective. So adjust or explore alternative strategies if needed. So maybe you do 2 weeks worth of, baseline data. You do 6 to 8 weeks of your intervention. And then you kind of look at it and say, okay, is this working? Is this not working? It didn't work. Go back to the team. What other things can we do? And then you're going to revise your intervention plans and put maybe additional resources if needed. And then report your outcomes. Document the outcomes of the intervention, including the successes of areas of improvement. And you can use, again, your tools, your progress reports, your presentations, meetings with stakeholders, and so forth to do that. So that is what you're kind of doing. And by doing that, this is a very structured evaluation kind of process the social worker can use to show, continuously assess their effectiveness, right? And make adjustments as needed so that you're, doing what's optimized best for the student. So when you're using this model in school social work, EIDM offers several benefits in the context of school social workers. You can provide more effective and personalized support by integrating evidence-based practices within the unique needs and preferences of the students and families. Also, the EIDM aligns well with the eco-behavioral model, which considers the interactions between individuals and their environments. The eco-behavioral model is an approach that emphasizes the dynamic interaction between individuals and their environments, and it recognizes that behavior is influenced by multiple factors, including the individual characteristics and the broader ecological context. So we'll talk about the ecological model in the next couple of weeks. So how does it align with the eco-behavioral model, the EIDM? So it's a very holistic approach. So EIDM aligns with eco-behavioral model by considering both individual behaviors and environmental factors. So for example, when selecting interventions, the social worker can take into account the student's home environment, the peer influence, the school climate. You do the same thing in the EIP, right? You have a dynamic interaction where you're emphasizing the continuous interaction between the student and their environment. You're looking at interventions that are designed to not only address individual needs, but also to modify environmental factors that contribute to the problem behavior. And then you have multi-level intervention. So EIDM supports this multi-level intervention that addresses issues at various levels, from individual to systemic. And this could include like individual, it could be individual therapy, group interventions, school-wide programs that foster a positive, supportive environment, and so forth. Some of the challenges that we have for the EIDM is same type of thing, access to quality evidence. So how are we able to kind of get that? The time constraints of the social worker that's there, it's going to be probably time on your time to get it started. Once you get it started and you know what you're doing, you just use it over and over. Again, resistance to change, and then the training and the skill. So you want to make sure that you have the acquired training so that you can do that process and use the critical thinking that you're needing to be able to do it. And the way you're going to get that is by doing it, right? The more you do it, the better you'll do it. So the last thing we're going to talk about is the strategies on how to overcome those challenges. So we're going to access to quality evidence. So utilize those online databases, professional organizations, access research, collaborate with academic institutions for resources. You could partner with a local university to gain access to the research databases, for example. You could have a really nice instructor who would be happy to look things up for you. Time constraints, you have solutions integrated. You want to look into your regular workflow and then use the data management tools appropriately. At first, it'll be a lot of work for you, but once you get this set up, your work should get easier because you know what works, you know what doesn't work. And so you're not going to waste your time on the kids coming back over and over again, all of them. The kids that you do have coming back over and over again where it's not working, then you know that you need to do this again and find additional resources for them. When you're looking at the resistance to change, again, you want to provide the training and demonstrate the benefits, foster a culture of continuous improvement, conduct workshops, and so forth, just like EIP. And then your training and skills and so forth. You want to make sure that you invest in yourself in your ongoing professional development and training, and encourage your peer learning and mentorship. Right? This is, you're getting your master's degree. You are a master level professional. Use those skills, right? Make sure that they understand who you are, and have them stand up and respect, what you've learned, because it's pretty impressive. And then enroll in online courses and so forth. All right, I read over that last one a little fast because I didn't want this to be an hour, and I got it down to 42 minutes, so that's pretty good. So you guys have a great evening, and hopefully this helps you with what it is that you're needing, and I will see you guys in our next class. Have a great day, or evening, night, morning, whatever it is that you're watching this.